Good day, everyone. My name is Thien Thien, and I'm delighted to interview Dr. Valentina Leta and Dr. Roberto Cilia about their recently published editorial in Parkinsonism and Related Disorders journal entitled "Watch Out for the Break in the Dam. Is aquaporins dysfunction the missing link between immune dysregulation, glial activation, and neurodegeneration?" which was published in Volume 117, December 2023 of the PRT.
Hello, everybody. So the term lymphatic system derives from the fusion between glia and the lymphatic system, and it is the central system counterpart of the peripheral lymphatic system, and it involves glial cells like the astrocyte. So it is a network of channels between the vasculature and perivascular astrocytes and allows the circulation of CSF and interstitial fluid within the central nervous system parenchyma, and provides a clearance of toxic metabolites and proteins like alpha-synuclein within the context of Parkinson's disease, but also beta-amyloids and tau protein for Alzheimer's disease. Within the pathogenesis of these diseases, it is important to state that the lymphatic system is associated with a water channel aquaporin 4 that is normally expressed on perivascular astrocytic enzyme. And this is important because the lack of aquaporin 4 in animal models, as well as decreased expression of aquaporin 4 both in animal models and in humans, increase the function of the lymphatic system and promote alpha-synuclein aggregation and neurodegeneration.
Aquaporins are part of the lymphatic system and has been associated with diseases such as neuromyelitis optica spectrum disorder and Sjogren's syndrome. Is there a link with Parkinson's disease?
Thank you for this question. As Dr. Cilia just mentioned, aquaporins are water channels which are important for the water homeostasis in different human tissues. And we have 13 isoforms in humans, and among them aquaporin 1 and 4 are mainly located at the level of the central nervous system, so are responsible for the water homeostasis at the level of the central nervous system. And we know that aquaporin autoantibodies against aquaporin 4 are crucial for the development of neuromyelitis optica spectrum disorders that you rightly mentioned, which is essentially an umbrella of disorders which can essentially is a demyelinating disorders of the central nervous system, which can often be associated with other systemic diseases, among them also Sjogren's syndrome. Essentially, also in Sjogren's syndrome, which is a chronic autoimmune disorder mainly characterized by lymphoplasmacytic infiltration of the exocrine glands in the human body, we have again a mislocalization of different types of aquaporins, mainly aquaporin 1, 3, and 5. And also we have autoantibodies against these aquaporins, isoforms of aquaporins. So essentially, we read with interest the review by Sandhi and Danda, which has put together Parkinson's disease and Sjogren's syndrome, suggesting a possible connection between the two. Also in Parkinson's disease, we have preclinical and clinical evidence suggesting a dysfunction of the aquaporin system. In particular, preclinical studies suggested that the aquaporin dysfunction can exacerbate neuroinflammation and protein aggregation, the PD pathology, in animal models of Parkinson's disease. And studies from humans, post-mortem studies, have showed a negative association between alpha-synuclein deposits and levels of aquaporin 1 and 4. So at the level of the neocortex, the temporal neocortex in Parkinson's patients. So essentially, there seems to be a common ground between the two disorders, namely a dysfunction of the aquaporin system. However, we need to clarify that while in Sjögren's syndrome there is mainly a dysfunction at the level of the isoform type 5, in Parkinson's disease, aquaporin that is mainly affected is aquaporin 4. So further research is needed in this field to clarify whether there is or not an overlap between the two disorders.
Thank you for the explanation. How would this hypothesis contribute to the pathogenesis of Parkinson's disease?
So the hypothesis of the pathogenesis of the disease is multifactorial. Aging itself is a factor involved in lymphatic dysfunction, as well as other factors like physical activity or sleep disturbance. And concerning the link between inflammation and inflammatory diseases and Parkinson's disease, we should mention that aquaporin 4 dysfunction. Aquaporin 4 is the link between the lymphatic system and the critical role of aquaporin 4 dysfunction and inflammation, including microglia, astroglia reaction and gliosis, and promote alpha-synuclein deposition and neuronal loss. So we are still waiting for further studies creating a robust link between neuroinflammation related to aquaporin 4 dysfunction, because we have already a lot of data relating neuroinflammation and Parkinson's disease. We need to understand why, if the aquaporin 4 dysfunction and the lymphatic system dysfunction is a cause or a consequence of alpha-synuclein deposition, longitudinal studies are still needed to assess a cause-consequence relationship. Several studies have been performed on Alzheimer's disease, so that the evidence on Alzheimer's disease are stronger and more robust at the moment than the ones on Parkinson's. And growing data are also published on atrophic lateral sclerosis, on the proteinopathy like dystrophy. The importance of co-pathology in Parkinson's disease, like in Parkinson's disease with dementia, or in Parkinson's disease itself, between alpha-synuclein pathology and beta-amyloid pathology. And the co-pathology now is the lymphatic dysfunction as the missing link between the two. We may also explain another piece of the puzzle of the pathogenesis of Parkinson's disease, explaining co-pathology as well. So lymphatic dysfunction, aquaporin dysfunction, neuroinflammation, and alpha-synuclein deposition of neuronal loss. All these pieces need to be put in a row by longitudinal studies.
So what would be the direction of research to further explore the lymphatic system and neurodegenerative diseases?
We certainly need more translational research covering the existing gaps in the literature between neurodegeneration, as Dr. Cilia just mentioned, neuroinflammation, the lymphatic system, and the aquaporin system, with a specific focus on aquaporin 4, which is a key player of the lymphatic system. And in order to do so, it might be useful to use a multimodal battery of biomarkers. I'm thinking about neuroimaging biomarkers, such as the use of DTI MRI to study the lymphatic system indirectly, or PET imaging study to study the microglia, or also the use of biomarkers in the blood and CSF, biomarkers for neurodegeneration and neuroinflammation. So we highly encourage further research in this field to cover the existing gaps.
Wonderful. Thank you so much for your time and your valuable insight in the lymphatic system in underpinning neurodegenerative diseases. The editorial would surely be an eye-opener for all the readers of PRD.
Thank you very much.
Thank you.